that Kostikov met with Oswald. This confirms the CIA reporting.
CIA veteran Bob Baer and former police lieutenant Adam Bercovici have returned to Mexico City, armed with new information about Lee Harvey Oswald's meeting with the KGB 8 weeks before Oswald murdered President Kennedy.
Or you may go to our I want
Download Pray.com right now, the #1 app for daily prayer.
I wonder what's streaming. What's streaming, you ask? Well, more than you think. At Redeem TV, we're streaming hope.
Oh, joy!
Romance.
And what is love?
Still more!
Is up.
Goodness.
Hi, I'm Jane King, and thank you for watching. This show is all about public, private, and blockchain companies. We bring you the innovators behind the companies making the headlines in that space. Some are sponsored, some are invited, all are curated and focused on telling you, the viewers, their story. Here we go. Tonix Pharmaceuticals just finished a trial of its COVID vaccine on animals. And with me is the CEO, Seth Lutterman, to explain the findings. So, Seth, I took a quick look at these. It looks pretty good. Can you go into detail about what your trial results were with this COVID vaccine?
Thanks, Jane. We're very excited. We tested our vaccine on non-human primates in an experiment where we vaccinated the animals with our vaccine versus two controls, either a sham vaccine or a vaccine that was closely related but wasn't designed to protect against COVID. And in the fourth quarter of last year, we announced very encouraging results about the immune response that these non-human primates mounted. But today, we announced that the vaccinated animals were protected against COVID-2. COVID-2 is the virus that causes COVID-19. So the top line of the results that was issued today was 6 days later, which is a relevant time in this animal model. The vaccinated animals had undetectable levels. So, and in contrast, the animals that were not vaccinated or were vaccinated with a control vaccine had much more.
Very interesting. Well, now we heard kind of as we've been studying all this, 94% effective. Do you have a number on that yet, or are you at that point?
That's a great question. Unfortunately, we can't get that kind of information from this model because these animals don't get as sick from COVID as humans do. But the model that we use is very similar to the models that were used by the EUA vaccines, for example, and all the other vaccines. And we won't have that kind of number until we get into humans, because we have to just look at the amount of virus we can detect instead of looking at how healthy or sick the animals get.
Now, when we talked last time, you had explained a little bit about your goals for this vaccine, that it might be something that it could be used every year. I mean, kind of explain how this would fit into the whole COVID vaccine ecosystem.
It's a great question. The three EUA vaccines, EUA stands for Emergency Use Authorization, and I think everyone now knows that they would be the Pfizer vaccine, the Moderna vaccine, and the J&J vaccine. They're all very important, and I first want to say that it's with great effort to get them approved. I personally am one dose into the Pfizer vaccine. I urge everyone to get the vaccine as quickly as they are eligible to get it in their state or community. But despite the remarkable achievements of Operation Warp Speed and the potential of these vaccines, they are first generation vaccines. And there are important questions left about these vaccines we just don't know. The most important is durability. How long will someone be protected? So we don't know, will they only be protected for 6 months, for 9 months? I mean, for me, that's a very good trade-off because I want to be protected for 6 months. But on the other hand, there are older, more established techniques of vaccination that can provide years or decades of protection. So while the EUA vaccines, the Moderna and the Pfizer vaccines are called mRNA vaccines, those are completely novel technology. And the J&J vaccine, called Ad26, is almost as new, although it was half of a vaccine that was used in Africa for Ebola, but essentially, at least with an American experience, new. So we just don't know the durability. One of the great advantages of those vaccines is how quickly they could be developed. And thank goodness, because hopefully they're making an impact already, because over 100 million people, I believe, in the United States have gotten their first dose. But it's no time to be complacent. We can't get a year from now and realize that the protection from these is only 6 months. We need other technologies. Also, after the pandemic, we expect COVID to be endemic, meaning that humans are going to coexist with COVID for the rest of the time that humans are on Earth. And that means that, like measles, mumps, and rubella, we probably will have to adopt a strategy of vaccinating children against COVID. So we are thinking in terms of that kind of vaccine, ultimately a childhood immunization that could be broadly deployed and tip the balance of this, sharing the earth with COVID, tip it in our favor in the same way that the MMR vaccine, the measles, mumps, rubella vaccine, has tipped that balance in our favor. And our technology, in contrast to Pfizer, Moderna, and J&J, which are new technologies, ours is the oldest technology. Literally, the first vaccine was a vaccine to protect against smallpox, developed by Edward Jenner in 1796. We believe that our horsepox vector is closely related to the virus that Edward Jenner used. That virus provides years, decades of protection, and it was the most successful vaccine ever because it eradicated smallpox, the only viral disease ever eradicated. So we're taking the best part of the old virus vaccine technology and applying it to this new threat. So I think that that's why we're very different.
Very interesting. So the vaccine is called TNX 1800, correct? So what's next?
What's next is we hope to study humans this year. And the gating item for that is manufacturing TNX 1800 in a quality suitable for human investigation. So that's our big priority. And now we really feel that's the one hurdle left for us to jump through, particularly now that we have what we think is compelling data in the non-human primate animal model. So we are guiding that in the second half, we expect to do human phase 1 trials. So we're rushing towards that goal.
And what are your objectives for 2021?
Well, the most important objective, as we've discussed, is to bring home the Raleigh study, the confirmatory phase 3 study in fibromyalgia, which with a positive study, a drug ready for NDA, would be transformative to our company. The other big thing we're hoping for, again, something we talked about, is to get our COVID-19 vaccine, TNX 1800, into a phase 1 human study.
Okay, well, thank you. Very interesting update, Seth, and best of luck. And please come back and update us as these trials and studies go on throughout the year.
Thank you very much for your interest.
Thank you. Winston Gold is a junior mining company, and the company works to identify and also develop high-grade underground mines that will have excellent potential for success. And with me is the CEO, Murray Nye, and also the Executive Chairman, Joseph Carrabba. Thanks again. Great to see you guys again.
Oh, hi, Jane. It's wonderful to be back on your show again. Thank you very much.
And I know we talked last time about you were kind of just starting to go to the mine and look for things. So we've got an update now. And Murray, can you give me an update on the underground development?
Yeah, sure, Jane. We're developing what are known as stopes. And basically, these are production stopes. So we've done enough underground development to get to 2 zones that we've identified through drilling that have what we consider very good grade of material to mine. So the first stope we developed was it's called the Custer West stope. It's approximately 200 feet in length. It goes up about 150 feet, and it's approximately 4 feet wide. The second stope we're developing right now, we're just about to break into it, is the term we use when we start to get in there and mine, is called the Parallel East. That is a similar type structure. It's about 200 feet in length by about 4 feet wide and also about 150 feet high. So those 2 areas are right now is where we're mining. The term is mucking the ore out of those stopes. They go to what's called a draw point, and then from the draw point, it's hauled out of the mine, and then it goes to the mill. The current mining rate we had before this rotation was around 90 tons per day. The crews are only working 8 days a week, or 8 days of rotation, and they're off for 6, and then they come back in. So we're planning on moving that up to 7 days a week. We don't quite have the manpower yet to do that. The second production stope will go online probably by Wednesday, or tomorrow, I should say. Mm-hmm. So at that point, we'll be going up to about 120 tons a day. So that was kind of our near-term goal, to get to 120. And then, of course, we want to run the mill at that rate too, so we can get a flow of material coming to the mill, so that we can start the mill up and start producing some gold and silver concentrates.
Okay, so you introduced the mill, so let's get an update on the mill from Joe. Joe?
Yeah, Jane, since we last spoke, we've made a lot of progress in the mill. Just to remind everybody, this mill that we're leasing right now with an option to purchase, it was down for almost a decade. So there was quite a bit of minor maintenance to do, and some older equipment that we needed to update. We've been able to do that. I have to say, there's been a tremendous backlog of equipment, which I know you hear about that in almost everyday life that comes with it, but all of the parts and pieces are now in, and they're installed. We've put in a new filter press as well, so we're taking a lot of the moisture out of the final concentrate that's coming in. We've put a new Whiffley table in for our super concentrate, and that's working very well. so we can pour a doré bar off of that and sell it to the local refiners as well. So we are also ramping up for 7 days a week. We've just hired another group for the night shift, if you will, that are experienced to bring on to run the mill. Labor is certainly an issue just about everywhere. Qualified labor in particular is pretty tough to come by, but slowly we're doing it. We've got a good reputation. We've got a good safety record for what we're doing. And I think the folks that are coming in see that they're going to have a job long-term with the prospects of the money that we've put into and the way we organize and run the mill around it. So we have about just our first container load, that is, that will ship this material overseas to be finally refined. We're right at 20 tons. So we've got our first container load, which we need at least one, if not two container loads to ship overseas to the refiners. We're in the final round of our draft contracts with a broker to sell the concentrate. That's going along very well. There's a good market for the concentrate where we are today, and the need for precious metals as well. So we're well positioned there as well. And that's kind of the last link in the chain, if you will, is now that we have the product, is selling the product. But it's a chicken and egg thing as well. You've got to have the product that's going to look more like the average that you're going to produce, so they can see what the chemistry is before they can make a final contract. So yeah, we've crossed those hurdles, and we're there, and we're very excited to see within the next month the first shipments head out the gate and head over to Asia.
Well, there's a lot more that goes into this than you realize. And you kind of know that there's a lot that goes into it, but there's even more. So let's talk about concentrates produced. Can you comment about that, Murray? What do you see?
Now, as Joe said, we've got basically three products we produce, Jane. And one is called a float concentrate. It has gold and silver in it. Some other, we actually have a little copper credit, it looks like. But primarily gold and silver. And then we produce, as Joe just indicated, a supercon off that Whiffley table that we can pour into a doré bar, if you like. That can be shipped to a local refiner in Idaho, and we get a quick turnaround on the funds from producing that. And then we get what's called a mid-grade con that will most likely add to the float con to beef it up as far as the gold and silver content is concerned.
Okay, Joe, anything to add?
No, I think it's just great. It's to see that first container load, almost ready for shipment, and being able to order the truck and the container in to go ahead and load it here in another week or so. So, yeah, that's an exciting event for us, and a big milepost to so we can get on our way to a positive cash flow in the next few months. So very exciting to see, Jane. And we've slugged through most of the winter, which, when you're using water in a mill like this, it always has its demands as well. So every day that it gets a little warmer, we do a little better in the mill and in the processing, and certainly in the mine as well.
Okay, so it sounds like things are progressing as you had hoped.
Yes, they are. Yeah, we are on track.
Okay, great. Yep. And I look forward to more updates as the summer months come in and you yield more information.
Great.
Sure.
So thank you.
Sure. Thanks, Jane.
Thanks for the update. Paypolitan uses blockchain technology to combine traditional banking with DeFi banking, decentralized banking. So with me to explain more about what Paypolitan is doing and where they are at this point in the year is the CEO, Nils Thorant-Ortiz. So good to have you back with us.
Thank you for inviting me again, Jane.
Okay, so you just finished an IEO last week on BitForex. So explain the IEO for those that may not be familiar with that term, and then how did it go?
Yeah, an IO is basically like an IPO, but on a crypto exchange. So it's going public, but instead of issuing shares, you issue a token, which is then bought during the IO from token holders. And yeah, Bitforex is a major exchange based in Hong Kong. We did this in order to add a new trading pair. So so far we only had our EPAN token and Ether, and now we added USDT. As USDT Tether is a stable coin that is giving more stability to the price of the token and is taking off a bit of volatility, which you normally have in those highly volatile coins like Bitcoin or Ether.
Mm-hmm. Now, can you do an ETO on IEO on another exchange?
Yeah, definitely. So we're still aiming on doing an IEO or a listing on a tier 1 exchange, which of course has to be at a certain time. So we have to have a certain growth over the year. And I think in Q3 at latest, we would be ready for a tier 1 exchange.
Okay. And then where do you stand with the Paypolitan app? Where's all that?
Well, actually, it's a great day. We just started today our beta testing.
Awesome. Okay.
So it was, we have 150 beta testers from the community. And so far, what I could see, the feedback, they're very happy. Paypolitan, just to explain in a nutshell, is a payment app. You can pay with cash from your bank account or with crypto. And we are not storing any money. We simply connect to your existing bank accounts or crypto wallets. So that is like the core architecture of Paypolitan, which makes it very safe because your funds, either crypto or cash, stay where they are. You simply aggregate them, and you can use Paypolitan to send them either from A to B or to make the payment with the Paypolitan app.
So tell me about the beta test, like how many people, how long will that last? What's the process?
So we invited 150 meter testers from our community. And internally, our 34 employees are also on board. So everyone is obliged to become a meter tester. Plus one of my colleagues who had an iPhone 6, he has to update his phone because it's not, you cannot update it. So we just noticed this morning. So he has to buy now, or we're going to buy, I think, for our colleague a new iPhone. And he can then also be the meter tester. So there is only one missing so far.
Well, I'm not going to make fun of him because I just got a 12 after having a 7 for years and years and years and years. So I definitely got my money's worth out of that phone. Now, there's a lot of terms, Nils, that when people are trying to learn about crypto, is, you know, we see Bitcoin and Ethereum do so well. Yield farming, staking. Can you explain what those two terms mean?
Yes. So actually our app is now starting with DeFi features. DeFi stands for decentralized finance, and staking and yield farming are this is the heart of DeFi. What is staking? Staking is locking a coin for a certain time, and this coin is then generating an interest rate. Why is that important? If you have a token that is listed, you need liquidity for that token. So this token can be traded. If this token from token holders is staked, that means this liquidity will stay there.
Okay, it's been very interesting already, and it's only March. So that'll be an interesting thing to watch this year. Nils, thank you so much for coming back. Always interesting to pick your brain about what's going on, and come back when you have the results of the beta test and we can update the interview.
I will for sure. Thank you, Jane. Have a good one. Cheers. Bye-bye.
Ehave Data Therapeutics is taking a leading role in the popularization of digital therapeutics using blockchain to verify records in the medical industry. So with me is the CEO of Ehave and also Mytopia Therapeutics is Ben Kaplan, and then also Manadeep, who is the medical advisor and also CMO. So great to have you both here this morning.
Good morning, Jane.
So now let's start. Ben, what are you doing at Ehave that has the street excited and talking about your company?
That's a great question. What we're doing over at Ehave right now is we're digitalizing personal health records and concentrating on mental health in the psychedelic sector. We are trying to improve the path that a health record goes from a doctor's office into systems of hospitals, EMRs, EHRs, and then gets distributed out and sold anonymously without the patient getting compensated. So we feel that there's a path there to have each person that has a medical record a way to compensate themselves through blockchain technology and smart contracts.
Okay, makes total sense. And we're hearing a lot more of that these days, people getting paid for their data. So Manadeep, I mean, the mental health, the numbers are astonishing. I mean, how could this make an impact? And as a medical advisor, what are you advising about this, the psychedelic treatment and mental health?
So we fundamentally believe that psychedelics has a very wide scope in addressing various mental health disorders such as mood-based, anxiety-based, and psychotic disorders. And we are aiming to sort of identify the underlying triggers using the technology itself so that we make a lasting impact on the overall space for the coming decade.
And then tell me a little bit about like this, you know, I mean, this is new research, and I know there has been a lot of really promising research in terms of psychedelics and treating depression and things like that. I mean, where does this stand right now in terms of a viable treatment for mental health?
Yeah, so definitely psychedelics has a long history since the human existence. It has shown some promising pathways when it comes to addressing various mental health conditions. And we identify that necessity of this molecules is in current circumstances is important more than ever. And the various molecules in the psychedelic sector itself have a very promising upside to treat and address various mental health conditions. So we believe the future is very bright.
Yeah, no, it's really very interesting research that's been going on to it and promising as well. So now, Ben, your dashboard, how and why would the medical community benefit? What role is blockchain playing in the healthcare sector?
Sure. Well, you know, the dashboard we created was to give a better connection between mental health and new compounds. And today, we're looking at connecting all the data from different applications and wearables into one system and giving insight to the doctors, a visual to assess the patient. You know, blockchain falls into the data sharing, security, and licensing with the presence of controls over the data. And today, we're looking to give a visual to a medical professional on what a patient looks like before they get analyzed using AI technology and certain surveys, so the professional can see what they are up against before they have to see the patient. So the blockchain and the dashboard together will compile a lot of the data that's sitting out there fragmented today into one system.
Okay, so that'll be valuable information that'll help going forward. So, Manadeep, do you think psychedelics might replace cannabis in terms of mental health, or is there a role for both of these as we move forward in healthcare?
So I fundamentally believe that both molecules in itself has a very bright future, and they can coexist. Despite cannabis has its own medical use, when it comes to psychedelics, it's very broad, and it addresses various conditions by addressing various aspects of human neuroplasticity. And we believe that down the lane, the psychedelics would have a much greater impact, but that doesn't mean it cannot coexist with cannabis.
Okay, very interesting and kind of cutting edge healthcare. So thank you so much, Ben and Manadee, for joining us and explaining this. And I look forward to some updates as you go through the clinical trials and expand.
Thank you for your time, Jane.
Thank you.
Thank you so much, Gene.